Hey everyone, welcome back to my channel. So, I'm playing with my lighting. So, if I look a little pale, it's because I probably am. It's been a rough 2 days for me. But I am in here to do a vlog. It looked dark to me. Maybe it's just me. Okay, but anyway, I'm in here to do a vlog. Yesterday I was laying around watching videos on YouTube, and I came across Teen Mom Amber Portwood's interview that she recently did with Dr. Phil about her battles with drug addiction and being in rehab and all that other stuff. I'm sorry, I just look so pale. And all that other stuff. And so it kind of inspired me. It got me to thinking about drug addiction and all this other stuff. So I decided to do a vlog. And because my brain cells, I had to take notes, which you all want to see. So the title of this vlog is going to be why I can't be addicted to drugs or any substance for that matter. To give you a little back history, I am a product of an environment that was a lot of substance abuse, more alcohol than anything. I can't say drugs. It was alcohol or whatever, but substance abuse is substance abuse. So I've been around it. I grew up around it. I know the effects. I've seen it. It wasn't foreign to me at all. So do I believe that I am genetically predisposed to be a substance abuser? Absolutely, I believe that. Just like it's in my DNA to be a black woman connected to my family with my familial line, and we have moles. You can see moles on my face, or I have lines in my finger. You probably can't see it. We have double chins as we age. We shrink as we age, just like I am predisposed for all those things. And I have diseases that, because of who I'm linked to genetically or who I come from genetically, it happens. Just like I am predisposed to that, I am predisposed to be a substance abuser. It's in me. It is what it is. I was born into it. It's a part of our genetic line. It's in me to be a substance abuser. Um, However, even though I know it's in me to be a substance abuser, as I was growing up, we had a buffer, which was my grandmother, who taught us it's in you. She never said, you can't do it or whatever. She always let us know it is a part of who you are, and you do not play with it. You don't play with alcohol. You don't play with drugs, because you are one sip away from being an alcoholic or being a drug user or whatever. So it's not something that we had the luxury of playing around with if we wanted to not go down that path. Now, if you wanted to go down that path, then you go ahead and you play with fire and you get burnt. But if you don't want to go down that path, don't play with it. Is that to say that I've never had a drink in my life? Absolutely not. I've had drinks in my life. But it's not something that I like. I don't like to be altered. It's not something, it's just not for me, partially because I know the dangers of it, and more than that, I do not like to be altered. I just don't like to be altered, and we'll get to that. For us, our biggest thing in my family, like I said, was alcohol. It wasn't drugs per se. It's marijuana, but to me, that's not a drug. I mean, it can be used for druggish purposes, but it's, you know, and I don't even mess with that. I have, and we'll discuss that later when my daughter is not home. I have her sequestered in the room with TV up really, really high, but still, you know, kids, they try to be nosy. Um, so, you know, alcoholism is a big part of who I am. As you all may know, I live with chronic pain, you know, and when you live with chronic pain, you have to get the pain under control. And the only way to get the pain under control is drugs. That's how you can survive. That's how I live from day to day. That's how I keep from jumping out a damn window or slitting my wrist, because the pain is intense. So how do I balance without going over the edge? Because again, even though it's a prescribed pain medicine, it's a narcotic, and some people use it to get high. So, and if I am genetically predisposed to like getting high, how do I balance? I balance because, one, I don't like to be altered, but I don't like the pain either. So I have to choose the lesser of two evils. I would rather take the pain pill, and first of all, nothing gets rid of the pain completely. I just need the pain to calm down so I can function. So depending on what type of day I'm having, if I am having a high pain day, my first dose will be 2 pills, which is, I should have brought them with me. It's like Vicodin or something like that. I'll take 2. If my pain is mediocre, like today, but I can feel it climbing, then I'll take 1. But I know how to play with the pills, and I know how far I can go with the pills. I know what I need to do to get my pain under control, but I also know how far to manipulate the medication and all of that. But even outside of that, if I did not know how to manipulate the medication, it's still what my grandmother taught me is in the back of my head. You one step away, you one step away, you one step away. And I remember that. Am I better than, you know, some people in my family who have fallen victim to substance abuse? Hell no. We share the same bloodline. I just chose to heed the warning. You're one step away. You're one step away. You know, and so when it comes down to me living with chronic pain and having to take narcotics, first of all, you don't get them frequently. So when I do get them, like I was just at the doctor's office Thursday, when I get them, I split them up, you know, and I put the emergency stash over here and I put some over here, because I know they have to last a long period of time, because my doctor, my lack thereof of a gynecologist, is an idiot. That's another vlog. So my medicine has to last a long period of time. So I split them up. Some days I endure the pain. If it's not mind numbing and it's not climbing, I will sit in my bathtub, use my heating pads, and just focus my mind and try to go somewhere else. But understand, if the pain is bad, I am popping those pills, but I'm not popping those pills with the intention of getting high. My focus is get rid of this pain before I jump out this window. That is my focus. It's not, oh girl, I'm going to take these pills and I'm going to be mellow. Because to me, it doesn't even, it doesn't feel, you don't feel high. You know, I be itching, sweating. You know, the pain, it takes a while. Like if I take 1 tablet, it's going to take damn near all day, depending on where my pain is at. If I'm at a level 8, it's 2 tablets. But if I'm at a level 6, level 5, it's 1. But if I'm at a level 5 and I take 1 and then I feel it climbing, then I'll go back and I'll take another one. But again, I do it with the intention of this pain gotta go. I can't let it get any more intense than it is because I don't want to go to the hospital. And if I let the pain linger after so long, my only option is hospital. I don't want to go. So I'm going to do what I can at home to prevent me from going. So when I take my medication, even though they are narcotics, it's not with the intent of I'm about to get high. It's with the intent of pain control. So that's how I balance myself, or that is the meter that I use to control it, if that's the right word, or to prevent me from crossing that line of being a substance abuser or being a pill popper or whatever. I mean, I had a conversation with my doctor on Thursday, who did I mention is an idiot. And no, I was crying, I was hysterical, and I have all my information and all my documentation. This was a new gynecologist, and she was completely overwhelmed by my case. I mean, she told me, you're too complicated, I can't help you. You know, and it was like, I'm gonna give you these pills, and she was gone, you know, or whatever. It was just a disastrous appointment, but like I told her, I'm not a pill seeker. You can look at my chart and see how many times you all have given me narcotics. And in this year, it's been 3 times. And imagine I don't go to the doctor, but let's see, I had surgery in March. I went back in 3 weeks in April. No narcotics because I had just had surgery. I went back at my 6th week, like the beginning of May, bleeding everywhere. She gave me medicine. And I just went back and it's October. So that tells you, you know, how I am or how I get medication. I don't get it often. I have had experiences with marijuana. I did not like it. First of all, I didn't smoke it because cancer is in our bloodline. I drank it. And the first time it was okay. I was in so much pain and I was told that it would help with your pain. It would help with the anxiety that the pain causes, because my pain causes me a lot of anxiety. The first time it was okay. I was not altered. I guess I was altered, but I wasn't, I was still in control. The second time, it was horrible. I was so gone. So gone. And I can talk about it because I hear the TV and somebody can't hear me. But I was so high, you know, and I hated it. I absolutely hated it. I felt so, even in my highness, I felt so much guilt and so much, you know, it makes you paranoid. Well, the first time it did make me paranoid. The second time it did make me paranoid. And Tamaya was in the house, and I'm like, my children have never seen me altered, you know, or drunk or intoxicated or none of that. My daughter is 21. She's never seen it. I've seen it as I grew up. And that's one thing that I vowed my kids would never see. And even though Tamaya don't know, and she didn't know to this day, I knew. You know, and I went to sleep or whatever, but it was the most horrific experience. And I will never, I don't care how much pain I'm in, I don't care how high my anxiety is, I will never, ever, ever, ever go down that road again. Do I think medical marijuana should be legal? Absolutely. More states need to do it, but it's not something for me. I advocate for it for other people, but it's not something that is for me. I can't do it. I cannot even. One thing that, you know, it did do for me, being growing up and being genetically predisposed to be a substance abuser or alcoholic, is it made me controlling. You know, I am very controlling. Not necessarily trying to control people, but I control situations. I like I said, I don't like to be altered at all. I never want my decision making capabilities to be diminished. Even when I had surgery, I mean, I remember telling my doctor, this was the first surgery years ago in Detroit. And I remember telling the anesthesiologist, I was like, you don't have enough drugs in this hospital to put me down. I'm not going to sleep. It's not going to happen. And she was like, oh, I done put soldiers down. I've put football players down. I can take you down. And I'm like, no, you can't take me down. You know, and so me and her had a little banter about that. And it was funny. But when she put the medicine in my IV, I'm talking 2 seconds, I was going. And I'm like, wait a minute, wait. She was like, oh no, I can't put you down, remember? And when I woke up, I was out of surgery. So I don't like to be altered. I just don't like it. I don't like my decision making to be limited. I don't like none of that. That's why I say I cannot be an addict. I'm not saying it's not possible, because it's in me. It's very possible. I got a bottle of wine downstairs that I've had for literally 2 years. Not open, just in the house. I was grocery shopping one day. I was having a moment. I'm like, I'm grown. I can handle this. Blah blah blah. This was just like in last 2 years, and I bought it, and it's never been open. D will probably end up cooking with it or something. So even when I was purchasing it, she was like, "Why are you buying it? You're not gonna drink it." I'm like, I am gonna drink it. I am gonna drink it. It's still there. On New Year's, I don't drink. We are not a drinking household. Dee will drink every now and then, like have a beer at a birthday party or, you know, a family gathering or something like that. But she's not into liquor either. You know, she cooks with it. But I'm not saying, oh, I'm too good to be an addict. No, I am predisposed to be an addict, baby. It's in me. It's in me. It's a part of who I am. So I know I have to control it. And the only way to control it is to stay away from it. I don't put myself in environments. First of all, for years, being around people who were drunk used to terrify me. I would be so nervous and so panicky. Like, I hated it. I absolutely hated it. Again, going back to, you know, what I grew up seeing, I hated being in clubs. I hated being in bars because I would panic, because I'm watching these people consume liquor and I'm thinking, what's gonna pop off, and you know, I'm gonna have to whoop somebody's ass and blah 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 blah. So I used to be afraid of it. I'm not afraid anymore. You know, I can be around people that are drinking. It doesn't bother me. You know, it just doesn't faze me anymore because I'm grown now and those anxieties and those fears are gone. But I'm not saying, you know, oh, I can't be an addict because I'm too good. No, I know what I am. I know who I am, and I don't deny who I am. But I also know how to handle who I am, and I don't play with who I am. So I don't allow myself to be in situations where there's even gonna be the temptation. First of all, I can't be tempted because I've never truly lived that life of a substance abuser or alcoholic. I've never lived that life personally. I've lived it like being around it, but I've never lived it. So it's not a temptation to me. But when it comes to being in pain, you know, and hurting, like right now I'm hurting. And when it comes to being in pain, I do have to yield to the narcotics because that's the only thing that will calm the pain down. So I had to learn how to, from day one, and I mean day one, I've been suffering since my late teens, early 20s. So from day one, I had to learn how to deal with it. I remember when I was a teenager and I was getting my teeth pulled. I had braces and they pull my teeth, and you know, they give you the I think it's Demerol. They give you, you know, while they pulling your teeth, they don't put you to sleep, but they give you the laughing gas and all of the Demerol. And I was so high. I was gone. I will never forget this day. I was so high. and I was talking and talking, and they pulled my teeth. And I remember saying to my mom, this was like I was like 12, maybe 14. I remember saying to my mom, I understand why drug addicts get high. That was the most amazing feeling. I ain't never felt nothing like that in my life. It was amazing. I am 39 and I still remember it. It was beautiful. And I told my mom, I said, I understand why drug addicts get high, because they're always trying to get back to that first high, that virgin high, which you never get back to it, because child boo, I got my teeth pulled again and that stuff was not the same. So again, even as a 14-year-old, I'm like, oh, this feels wonderful. When they said they had to pull my teeth again, I'm like, yes, I'm all for it. Let's do this, whatever. But why did it feel like that to me as opposed to another 14-year-old? Because it's in me. It's who I am. But now that I live with chronic pain and I have to take narcotics, I learned how to play with it. I know how far to take it. I know what to do with it. I know what not to do with it. And I think what keeps me from crossing that line is looking at having examples in my family of what crossing that line can do to you, and then the warning from my grandmother that plays in my mind. You're one step away. You're one step away. My grandmother used to say we couldn't handle it because we had too much Indian blood.
It went off.
Okay, sit down and watch something else. Just sit there. Close the door. Close the door. Kids. But I remember my grandmother saying, we had too much Indian blood and that's why we couldn't handle liquor, or whatever. And my family was a partying family. Baby, we party like none other. My grandmother's birthday was January 1st. Need I say anymore? We party like none other every year until, let's see, my grandma passed away in 2000, until like 1990, no, I'm gonna say 1991. We party every year. Everybody's birthday was a party. Everybody. Fireworks, gunshots, the whole nine. My family used to be fun as hell. We had mega fun. We ain't need friends. We had fun with each other. Even though I had friends, child boo, they came on in the party too. We had mega fun. So even though I live with chronic pain, and I have to depend on, pain medications and stuff like that, I can't be an addict. I can't. Not because it's not in me, because I won't allow myself to become an addict. But I am very conscious. You never know what's up the road. Life can throw you some loops, some twists, some turns. I'm the poster child for life will throw you a curve. I don't know what's up the road for me. You know what I'm saying? But I do know what I cannot do. Can I sit here and tell you that I will never be addicted? No, I cannot. All I can tell you is that every day that I live, I tell myself, I heed the warnings. This is not the life for me. It made me controlling, but if that controlling nature keeps me from being a substance abuser or alcoholic, works for me. My children don't live, my child. But anyway, cutting it short. I don't know what's up the road for me. So I just have to be conscious of what I'm doing, conscious of how I handle my medication, conscious of the decisions I make, and I'm good. I can't be an addict because it's not an option for me. Is it a possibility? Yes. Is it an option? No. I cannot be addicted. I can't be an addict. It's just not an option for me. So these have been my thoughts on this situation. I really wish Amber Port would the best. I mean, she was talking about how she was chewing fentanyl patches. I'm like, that's a new level of getting high. The documentary was really like eye-opening, and I'm like, man, she was doing some hardcore stuff, and she's so young. But when you're predisposed to addiction, it will come and get you. It doesn't matter if you're 12, if you're 15, if you're 30, if you're 50. It's there. And if you're not conscious of what you're doing, It's coming for you. It will snatch you up just like that. One sip, as my grandma would say, and you're in it. You're in it, and you be in it deep. And when you look up, you so deep in it, you don't know how to get yourself out. Or something tragic happens, and that's how you pull yourself out. I mean, she opted to go to jail. She was like, it was either jail or death. And she has a daughter, so she chose jail. And that's how she turns her life around. Substance abuse, drug addiction is no freaking joke. Once that stuff latches onto you, you carry it like luggage. Even people who are sober, it's a daily fight. I don't want to live that life. I fight daily with pain. I don't need to pack on something else. So being addicted, it's not an option for me. Because is it a possibility? Yes. Option? Hell no. I carry enough. I'm not about to pack that on too. Thanks for watching, you guys. I will be back with another vlog. Remember to rate, comment, subscribe, and share. And as always, be amazing.